My name is Scott Richardson, and it's time to discuss birth defects. So, what exactly is a birth defect? According to the dictionary, a birth defect is a physical or biochemical abnormality that is present at birth and may be inherited or the result of environmental influence. So, let's dive deeper into the subject. You may have heard or seen people with birth defects, but have you ever stopped to wonder what they were caused by? There are a wide range of possibilities that can lead to a child being born with a birth defect. We will be discussing 4 of those occurrences today. The first occurrence we will observe is the mutation of one gene. An example would be that of translocation. Translocation occurs when a piece of one chromosome breaks off and attaches to another one. If there is a loss or gain in genetic material, the translocation is described as unbalanced. Translocation can lead to Down syndrome. Down syndrome is the most common birth defect in the United States. It was first described in 1866 and is named after John Langdon Down. In the US, Down syndrome occurs in 1 out of every 800 infants. There are more than 350,000 people living in the United States with Down syndrome. A second type of mutation occurs when there is a change of chromosomal structure. This type of birth defect can occur through the deletion or the duplication within a single chromosome. During duplication, an extra copy of the chromosome region exists. In deletion, however, deficiency occurs. There will now be less genetic information in the mutated chromosome. Both deletion and duplication occur in an abnormal crossing over during meiosis. Now let's talk about abnormal chromosome numbers. There are 2 types of changes in chromosomes. Changes in whole chromosomes called euploidy and changes in parts of the chromosome called aneuploidy. We will be focusing on the latter in this presentation. The primary cause of aneuploidy conditions is the segregation of homologous chromosomes during meiosis or mitosis. The condition comes about if this happens and results in the chromosomes moving to opposite sides of the cell. Teratogens are substances to other factors that can cause congenital abnormalities, which are also called birth defects. Examples of teratogens include certain chemicals, medications, and infections or other diseases in the mother. Scientists in the 20th century classified teratogens into 4 categories: physical, chemical, or infectious agents, and material conditions. Physical agents include ionizing radiation or other agents that contribute to hypothermia or elevated body temperature. Ionizing radiation is radiation composed of particles, X-rays, or gamma rays that carry adequate energy to free an electron from an atom or molecule, resulting in electrically charged ions in matter. Aminopterin is a drug that is used to treat cancers. This drug blocks folic acid, and folic acid is important for production of DNA and cell growth. Therefore, folic acid helps prevent many birth defects, most notably neural tube defects. Some anti-epileptic drugs are associated with a wide range of birth defects, such as cardiovascular abnormalities, cleft palate, and microcephaly, which is a condition where the brain is too small. These drugs include phenytoin, valproic acid, and trimethaddone. Warfarin, a blood-thinning drug, is a teratogen. Warfarin can cause central nervous system defects, including mental retardation, as well as problems with the optic nerves. Infections such as those are caused by rubella virus, herpes simplex virus, and syphilis. There are 4 types of birth defects that we will be talking about in today's lesson: sickle cell anemia, Klinefelter's, hemophilia, and Turner syndrome. In sickle cell anemia, the blood cells are broken down into a sickle shape. These types of cells will die early. This can cause a shortage in the healthy blood cells, and it could also block blood flow. Common signs include pain in the joints, sudden pain in the chest, dizziness and fatigue. Klinefelter is most evident in males. This happens when a male is born with an extra X chromosome. Klinefelter's is the result of a random genetic error after conception. Only males can be born with this syndrome. Common signs include reduced muscle mass, facial hair, body hair, and lower testosterone. Hemophilia occurs when the blood doesn't clot properly. This causes excessive bleeding internally and externally. Turner syndrome is a chromosomal condition that affects only girls and women. This results when an extra X chromosome is missing or partially missing. It can cause a variety of medical and developmental problems, including short height, failure to start puberty, and heart defects. Now that we have talked about these different types of birth defects, let's talk about its connection to bullying. What is bullying? Bullying is unwanted aggressive behavior among school-aged children that involves a real or perceived power imbalance, according to StopBullying.gov. It is quite evident that bullies would pick on those who have birth defects. Kids with birth defects are less likely to defend themselves and already have a low self-esteem. These kids with birth defects are especially vulnerable. Because of difficulties with social interaction and ability to read social cues, children with autism and Asperger's syndrome have higher rates of peer rejection and higher frequencies of verbal and physical attacks, said Robin Kowalski, a psychology professor at Clemson University in Clemson, South Carolina. Bullying is a problem that needs to be stopped. Bullying can lead to many negative effects such as suicide and social anxiety. Please do your role in helping stop bullying, and don't just be a stand-by. Instead, go and tell a teacher or stop the situation before it increases. Thank you.